Thanks everybody who joined us today. My name is Joseph, and we're here talking today about weaving asset mapping and community development into social prescribing. So thanks for joining us.
Hi, everyone. I am Grace Bonnet. I'm joining in from rural southwestern Ontario, small agricultural community of Hensel. I've really enjoyed implementing our social prescribing process here at Grand Bend Area Community Health Centre, integrating my background in health equity, grassroots community development, and rural health research throughout this process. And I look forward to sharing our experiences with you today.
And I'm Joseph Butler. I'm in Ottawa at Carleton Community Health Centre. I'm a social worker here, and I have experience in casework, community development, and I have a very much focus on holistic practice. So that's part of what informed our decision to talk about asset maps and really get interested in asset maps. Cool. So we've got a few things we're going to go over today. First being an overview of asset-based community development. You'll hear us call it ABCD at times, but asset-based community development. Then after that, we're going to go into making asset maps within different community contexts, the different types of asset maps. Later on, I'm going to do a live My Map demonstration, which is something that I'm really passionate about for using for asset maps. And then at the end, we'll have a quick question and discussion period. So we'll start with Grace.
Okay, so we'll start with just kind of a very high-level overview of asset-based community development. I know that's a term that gets thrown around a lot, but some of you may not have a very thorough understanding of it. So we'll just kind of highlight that and the alignment between asset-based community development and social prescribing, and how integrating that kind of process into your social prescribing work can really provide a lot of benefit to the overall success and impact of your program. So as opposed to me standing here explaining it, I'll just show you a quick little video here from Cormac Russell on asset-based community development.
Thank you. The question, can I help you, is a question that millions of people ask millions of other people every single day. What does it actually mean to help another human being, or indeed to help an entire community? I believe that helping is a powerful and often beautiful human impulse. But I also believe that helping has a shadow side. That certain styles or forms of helping are actually doing more harm than good. Roosevelt Moss Cantor, the Harvard academic, puts it beautifully when she says that when we do change to people, they experience it as violence. But when people do change for themselves, they experience it as liberation. Today, I want to present a very simple idea. And the idea is this. If we want to help people in a way that does no harm to them and their capacities and their communities, then the best place to start is with what is strong within them and within their communities, and not with what's wrong. There is an abundance of evidence that calls us to this way of helping, including the 75-year study on what makes happiness possible, the longitudinal study from Harvard, which reminds us that it's best to lean into our relationships and to create community rather than lean into ourselves and money. And the work of the Kettering Foundation, which studies what happens when democracies work as they should. And indeed, here in the UK, the work of the new...
Okay, so really just the heart around asset-based community development is just shifting that focus from what's wrong to what's strong. And anyone who's doing social prescribing work will know that that is also the primary focus around social prescribing as well. So as Cormac Russell stated in that video, different forms of helping can actually do more harm than good. So we know that if we're taking a top-down approach, as professionals or experts in the field, whatever profession you're in, doing all of the work, in some cases, we can actually have the opposite effect that's intended, and it can actually be detrimental to the clients that we're serving. So we have to ensure that the change is coming from within to ensure our clients feel empowered, encouraged, and motivated to continue with whatever that change is. So a common framework used in asset-based community development is through these 4 modes of change. So 2, 4, by, and with. Those 2 and 4 models are needs-based approaches. So doing things for our clients, imposing that change, often serving an agenda distant from what's actually wanted or necessary in a community or an individual. And then that with and by approach is that collaborative asset-based model that's clearly highlighted in social prescribing work. So really shifting that narrative from what's the matter with you to what matters to you, and promoting that co-creation of solutions that's very evident in social prescribing. So moving on to the next slide, just based on that limited description of asset-based community development, I'm sure it's becoming clear the key areas of alignment between asset-based community development and social prescribing. So as you can see on the left, these are key principles of asset-based community development, and then the right, the 4 main principles of social prescribing. So focusing on that person-centered and community-led service provision. So placing service users at the center of the design and delivery of social prescribing, and understanding that they play a central role in developing solutions based on their own needs and opportunities as well. And then, as I touched on in the last slide too, the co-creation, engagement, and collaboration. So really taking that interdisciplinary approach to healthcare, involving community resources, service providers, allied health professionals, primary care providers throughout that process, as well as supporting and engaging clients in the process too, highlighting their individual gifts, interests, and goals. And really having a holistic and solution-focused approach. So obviously, in social prescribing, we look at that, the opportunities, the solutions that are involved in coming up with that well-being plan or whatever it may look like at your center. And recognizing that clients and communities are more than their issues, and they each have unique gifts, talents, and goals, and it's important to optimize on those. And within this too, just kind of looking beyond those medical interventions and shifting the focus to the community and social resources and services, those unique resources that are in the community that we don't necessarily think about as primary care providers or healthcare providers. And then finally, just remembering that this process is iterative and nonlinear. So, when we're working with community and when we're working with clients, it can be very complex and it can be a messy process. So it's important to just ensure that your processes are open to flexibility and diversity, and whatever is thrown at you, you're able to kind of adjust accordingly to that, because ultimately each of these programs that we are implementing for social prescribing are context dependent and unique to our centers. And we'll highlight that a bit more, but even in the work between our center and the work Joseph is doing, because I'm located in a rural region, he's in downtown Ottawa, both of our kind of processes of developing an asset map look very different. So it's important to understand that these programs need to be flexible and open to change.
Now we're going to get into the asset mapping component of this, where ABCD and so asset-based community development and social prescribing kind of work together, as well as asset mapping in itself. So like we talked about, there is no right way to asset map. There's no right way to also do social prescribing or asset-based community development. There are ways that work better than for others. They're impacted by various factors: context, capacity, and location, implementation stage, services available. It's not every one is going to work for another one. And there'll always be a way that we have done our asset map that are simply not feasible at other centers. So if it works for one, it might not work for another.
Yeah, so this slide just kind of shows two models that are commonly used in asset-based community development to kind of initiate that asset mapping process. So whether you're doing it with an organization or you're doing it with a community, these are just some kind of guidelines to help facilitate that conversation in identifying the strengths in whatever context you may be looking at. And, you know, I personally didn't use either of these when I was developing my asset map for the social prescribing here at our center, but it may work great for the work that you're doing. So just like Joseph had mentioned previously, it's important to just remember that it looks different for every center. So we just wanted to kind of gauge where each of you are at, and wanted to hear kind of what your initial thoughts were around asset mapping and what your take on like traditional asset mapping was. So when, you know, you started the project and you understood that we had to develop this asset map, what did that look like for you and for your center? We're just curious to know. So if you don't mind just putting your answers in the chat, we'll kind of have a discussion that way, if that's okay. Or if no one is, Sabrina, feel free to share your response. There's nothing coming through in the chat right now, so.
It was too much to text. I was gonna say, like right now with my project, Black Focus Social Prescribing, it's just challenging to find culturally safe and culturally appropriate African-centered programs. There's a lot of grassroots things happening in people's like homes or in community centers, but something that's formal to find it online or be connected, that's one of the challenging. And then in the past doing this work, it was just so broad. It was just like a big social services 211 versus nowadays when I see it is very kind of specific, which I love. It's easier to map out that way. So if you want like restaurants, if you want sporting goods, if you want, you know, so yeah.
Yeah, definitely. And I think that was a challenge for me too. Trying to find those informal resources can be very challenging. And you know, using 211 is great, but it does highlight a lot of those kind of clinical resources or those formal events or services or whatever it may be. So really, yeah, diving into the informal kind of grassroots services and resources in the community can be a challenge. And I think we'll touch on this in a little bit, but partnership development and, you know, getting out and meeting others in your community and doing that community development work really helps to identify those services and resources.
Okay, and there's a few things in the chat here. So what's applicable to my clients being a reliable, safe community resource? So that's a big thing, right? What might work for someone might not work for others. So understanding demographics, and it can be hard because you might hear about a great service, but not know about the extent of which it's applicable or appropriate or even comfortable for your client. I know I've had to support clients going to places that are even supposed to be the most welcoming place you could be for someone who struggled in that particular way. We heard a lot of centers saying they didn't want to start a resource or tool that they can't maintain. That's a big thing. That's a huge thing. No matter how you do an asset map, and I'll talk about this more, you have to maintain it. It's always going to be going out of date. It's a tool, so it needs someone feeding it for it to work. And it's tough to know what you want to put your time into before you really set into something, which is sort of the reason why I kind of came up with this whole thing where I was thinking about the way I like to do it. I was given something and I thought, well, I don't really think I'm going to use this, so maybe I'll try this other way. Yeah, and the services change constantly, so it's hard to keep an up-to-date tool. One thing I'd say about that is that even if a thing goes out of date, if you know where it was, you can probably contact the people there who ran it at some point, and they can point you in the direction of someone else. Okay. Another challenge, find resources that are cost effective. Yep, cost effective, free for clients with monetary challenges. That's a big thing. So again, when you find them, marking them down. Okay, we've got a fair amount to get through, so I'm going to jump into the next part. Okay. So it's crucial to consider that each asset map is not going to work for everybody. It's going to work different for your center, for your workflow, for however it is your center has decided to take on social prescribing. And it's important to know that, like I said, yeah, it's going to be different for everyone. I mean, I'm a full-time social prescriber here at Carlington. Grace has other positions and stuff she's doing as well, so she doesn't have the same capacity as I do maybe to take that kind of stuff on. So it really is about what fits your situation. And no matter what, like I said, it's always going to be evolving and going out of date. Programs start and finish all the time. So it's important to understand what you want to get out of it and how much you want to put into it. A few key considerations when making an asset map is, does it need to be low or high tech? Depending on the provider's capacity and general staff knowledge, what's practical and user-friendly? Something to consider. Another thing to consider too is, what is the geographical location? Are there many places that offer services or only a few? Consider possible barriers such as transportation, catchment area. Again, I'm in an urban area. Grace is a bit more rural. So there's tons of things that I can send people to here in different places, whereas Grace might have a handful that she's comfortable with working with. And then also, what is your context or social prescribing model? Is there a designated social prescriber at your site, or is it someone doing it off the side of their desk? Are you developing the asset map individually or as a team?
Yeah, and then also just considering who will be managing and using the asset map. So before you even start developing the asset map, it's important to think about the sustainability piece. So who will be doing that consistent updating? Because we know that that is a key component of an asset map. And on the kind of more front end of things, who will be using the asset map? So are you going to be sharing this with your clients? Will you be sharing it with providers? Or will it just be internal within your health promotion team or your social prescribing team? So considering that, and then also the factors that are associated with that. So privacy issues. If you're developing an asset map and you're getting contact information that maybe can't be shared with your clients, then that's something to consider when you're looking at who will be using that asset map. And then also organizational capacity. So when you're looking at the programs and services that are available in the community, and I know it was mentioned in the chat as well, highlighting those strengths, but also thinking about those gaps as well. And where those gaps exist, does your organization have capacity internally to address them? Or do you have partnerships developed within the community that you can kind of co-create those solutions? So you provide them with, here are the areas where there's gaps that need improvement. And, do you as an organization have the capacity to develop programs based on this? So thinking about that too, and partnership development is a key piece of developing the asset map as well. And then also, is it adaptable? The community is constantly changing, the services provided, the events are constantly changing. So can your asset map easily be updated and adapted based on, the changing needs of the community and the changing programs and services within the community? Also just adding to that piece, because a lot of us are developing our social prescribing programs kind of from the ground up, as you go throughout that process, your needs for the program will change as well. So is your asset map adaptable to that process as well? As your social prescribing program expands, does your asset map have the capacity to do that as well? Or, if funding or staff changes, will that asset map be sustainable? Or is it just going to be null and void after that? So those are kind of some key pieces to consider as well.
All right. This is by no means an exhaustive list of different types of asset maps, but these are some of the ones we've kind of used ourselves. I use like 2 at the same time. I have like another one, but I have one main one and then kind of little other things as well. So maybe having, multiple versions at your site is what works for you. Maybe having one. But these are some that we've found. We wanted to kind of highlight the pros and cons of them, what we like about them, what we don't like about them, and also kind of go from like low tech to high tech. Because for some people that just doesn't work. What does work is, totally dependent.
Okay, so in its most basic form, I would say, at least for what Joseph and I have looked at so far, would be an email folder. So if you want to just go to the next slide there, Joseph. So when I was initially starting this process, I was reaching out to various kind of community organizations, service providers, to see what's out there. So my first step was to develop an email folder where any emails that came through that pertain to the asset map, I would just move over to that folder. And what was really helpful with this was that, you don't always have time to take that and do something with it right away. So you just can move it over and then, check in on it once a month or whatever it may be, or once a week or whatever kind of works for your schedule and your capacity. So this is kind of what it might look like. And obviously it's different for everyone, but I receive multiple emails monthly from various organizations. So this one's from Canadian Mental Health Association, our local CMHA, just sharing their October program. So I probably get 5 or 6 emails like this at the start of each month or at the end of each month, more so, just providing a bit of an update on what their upcoming programs are, what events they may be hosting, any changes to their programs. So I take this information and then update it in my more formal asset map. So kind of the back end of this started by just reaching out to a bunch of community organizations and requesting to be added to their email list, kind of just sharing what I'm doing. And, if there's ever a program where there may be opportunities for partnership, then welcoming that opportunity, and ensuring that I'm receiving these updates so that, all my referrals are informed by up-to-date information. So one key consideration when you are doing this, if you are sending out emails to receive this information, it's important to consider what you're looking for and be clear in that ask. So what are you including on your asset map, and ensure that you're receiving all of that relevant information. So whether it's eligibility for their programs, cost, volunteer opportunities, specific program dates and times, the intake or referral process, whether there's any kind of restrictions, are there geographical boundaries, or is it accessible? So really kind of gauging the program as a whole and assessing, what is available within that program so that you can, again, provide informed referrals to the programs. Go to the next slide there. So some pros and cons of the email folder. You have up-to-date information. So because you are receiving these monthly or however frequent it is, but because you're receiving these updates, it's relevant based on that given time. You have date stamps for everything. So you can look back and see, this organization was running this program last November. Maybe I'll reach out and see if they're running it now in the spring. Easy access to all of the links and attachments within the email. I know when you kind of get to more complex asset maps, it might be more difficult to include that information, whereas in the email folder, you can just click on the link and it's right there. It's more personal, so you do, develop those relationships, develop those partnerships and opportunities for collaboration. And it's a single step. So like I said at the beginning, most basic form, it's nice and easy. You send an email, you get a response, and there's, your assets. Some Downfalls to the email folder, lack of organization. So it's difficult to kind of filter through this information and navigate through it. And it's very individualized. So each program and service or each organization is kind of organized differently. So it's, again, more difficult to navigate with that. Can move on to the next asset map now. So this is the Excel document, which I think a lot of folks probably, that was your kind of first thought when you thought about asset mapping. I know for me, that was where my mind immediately went. And I thought, wow, this is going to be great. It's going to be, you know, the best way to do it. And it works for sure. But it can be a little bit overwhelming. So this is what my Excel asset map looks like. So kind of step 2 to the email folder after reaching out to organizations and getting the information. I translate all of that information into an Excel document. And also this information is informed by, you know, Google searches looking at local libraries, municipalities, service clubs in the community, and adding all of that information in. So you can just go to the next slide. You can see some more of the detail that I include in the asset map. So yeah, the service or resource, organization, the target audience, location, date and time, whether it's recurring, group or in person, some extra information about it, cost, eligibility, website, and any contact information. So there's a lot of information you can include in an Excel document. And, you know, that is helpful. That is definitely a benefit of the Excel. And low tech, it's fairly easy to kind of put it together. There's flexibility in the amount of tech you can use too, which is nice. If you wanted to, you know, take it a step further and have filtering options, then you could do that. But some downfalls to the Excel, there is a lot of information. So I know for mine, it doesn't fit on one screen. So you have to kind of move around and try and look at it just to look at one organization or one program or service. You kind of lose sight of everything. You can't see all of the information at once. And then also, you know, it is that multi-step. So you're reaching out and getting the information, and then you have to translate all of that information into an Excel. And depends on how much information you are including, but if you are including specific dates and times, like I did in my Excel, including, you know, the date and time of the program and whether it's recurring or not, then it does require a lot of updating. You know, every 4 to 6 weeks, you'd have to go through and update it if that's the average time a program runs in your community. So that would be a downfall to the Excel.
Okay, so the next one is web browser folders, which is something I use in tandem with the other one I like to use a lot. Let's see it pretty quick. Oops. So it's literally just taking your browser and making folders within it with categories. Each category has a certain demographic or type of program. It's really, I mean, it's specific to me because my brain works with, okay, this is a city program, this is a program for youth. Some of them are, you know, one or the other or in multiple categories. But that's one of the nice things about this, as opposed to, say, having an Excel sheet where you have one line for each one. With this, you can, say, add something to multiple categories. And then you start thinking about demographics and you start thinking about certain programs and how they work. Just a bit more, you can have one, you know, full on seeing like different kinds of things within it. You can have folders within folders within folders if you really want to and get really in depth. And just making it flexible to you, to where it works to you. So I still use this as well as another kind that we're going to get into in a second. Okay, so that's an example of like employment stuff. We have the YMCA. So some of the pros of it are assets can be easily sorted and put into multiple category folders. Assets are connected to websites, which often stay up to date. So staying up to date is one of the hardest things with asset map. It's always going out of date. It's easy to add and remove assets from folders as they change. The cons are that they're not viewable by location. I don't know about other people, but when I hear the word asset map, I really leaned into the map part, and that was something that was important to me. It's easier to lose assets in older folders, so you might not see them if you're not searching for them, or they might get, if you have a folder within a folder within a folder, it's going to get lost. And they're not searchable by type. You can view them at the very basic level with each folder, but it can get a bit daunting when you try and go beyond that.
Okay, so as Joseph mentioned, map was a kind of key focus for this initiative for our social prescribing. So we'll show a bit more of a high-tech option for asset mapping. So you can go to the next slide, Joseph. So this was our take on asset mapping, developing a Google My Map. So I'll just kind of briefly go over this because Joseph will be going into more detail on this. But it allows you to place pins on a map and include various information on it. So this would be a more basic form of a My Map. As you can see, I just have, a single color, single pin, but you can search by location, by keyword, by organization, and it comes up with all of the information or all of the resources in the community that meet that criteria. So you can go through there, Joseph. Yeah, so pros and cons of this Google My Map. So very easy to identify gaps. You search yoga, if nothing comes up, okay, well, there's a gap. So that is one really key component for this iteration of an asset map. It's filterable, as I mentioned before, and categorizable. So again, Joseph will go into more detail, but you can categorize based on, I think, 9 different categories or overarching themes. Some cons, so it is higher tech. It may be a challenge for some organizations to implement this within their process because it does take a bit more kind of technology focus than the other forms of asset maps, multi-step. So again, you still do have to do that back-end research to get the assets and then take those and translate them into the My Map. So a few extra steps involved. And yeah, just sometimes it can be a little bit overwhelming just with the lack of standardization in the information formatting. So where you can include detailed information, it doesn't really have any set process or format for that. So sometimes that can be a bit more difficult. And Joseph, you can go ahead and share your My Map now.
So I'm going to go a little bit into my My Map. And just to clarify, My Map is a subset of Google Maps. It's one where you can show what, I think it was originally made for like vacations or something. So you could mark a spot on a map. You could write whatever you want within each spot, use it for whatever you want. I'm going to kind of give you an overview of my My Map of Carleton and Ottawa. And then I'm going to try and rush through this so I can show you how to actually make your own at home really quick. But we're running out of time, so we might go over. So I'm going to try my best to show what I can. So this is my map of Ottawa. The little arrow points to where Carleton is on the map. And all those different little pins there are all sorts of different services or things that I and my team have added to the map. You can get a bit closer, start to see, okay, so there's certain things close to us within the area. All the blue markers are me. I've marked all those. There's green ones that are one of my coworkers. And you can see the various colors, little icons. The most important thing and the best thing about this is 2 things. It's on a map, so you can see where it is. And the more and more that we have housing shortages or people are further away from where they're receiving service, this becomes really important. So you can immediately see what's in that person's general area, what's close to them. The other thing too is everything that's written within a key, like within a pin, so each of those is a pin, it can be used as a keyword. If it's the title of it, if it's the description within the pin itself, it makes it all searchable. So you can see here, I've searched health. Some of them have it in the title. Some of them provide healthcare services. But the second you make it on your map and pin it to one of the things you've put on your map, you get to see what's within it. So everything above the line where it says highlight matches, everything above that where it has a colored pin is something we've already marked on the map. Everything below it is something we could potentially add in the future. And you can see a bit closer. So there's the highlight of all matches from the map. And then everything above that. So you can see all the community health centers here are marked. I did the same thing with sports. I have a bunch of places I like to work with. Some of them have sports in the name, some of them don't. But being able to search it really quick makes it super accessible. Okay, so you're probably wondering why there's like a thing that looks like a donkey on the middle of the map. That's actually our catchment area at Carlington. It's, you know, downward dog, it's a donkey, it's a horse. I'm not sure what it is or if that was intentional, but I think it just kind of happened that way. But you can see that it's very specific in what's in the catchment. And when you're looking for wraparound services for clients that do live in catchment areas, because community health centers do tend to work with catchment areas in terms of who's receiving primary health care, but we have tons that live without it, outside of it. So it's kind of an older thing. But it's good to know where the catchment is. So some pros of this are assets and information is searchable by keywords. So to me, that's the most important thing. You couldn't do that with Excel. You can kind of do it with email, though you wouldn't see a whole bunch of things at once. You might see one at once. Assets are connected to up-to-date websites and phone numbers. So the second you put a pin on your map, it's showing where it is. And it's showing the address, the phone number, the email, the website automatically. And then you can add all the other stuff you want onto it, whether it's whatever contacts you have or, you know, is it accessible? What are the keywords that you want to make, right? So it's easy to add and remove assets from the folder as they change, which can be a little scary because it's actually really easy to remove things from it by accident. So you have to be careful. But that goes hand in hand with being able to share it amongst the team. I know someone asked in the chat about sharing amongst the team. I would say, share it with people who you can trust that aren't going to show it off because you might have certain information on there. It's a very tedious tool. This is one way we've looked at it. And so it's important to know who has access to it, who's adding stuff. And if there's, say, a mistake or you want to look back on something, you can talk to them. Assets are viewable by location and see how close it is to the client's home, the catchment. And it's very customizable and be used for any sites differently. I think any site could use it if they're comfortable with it. It's practical to easy and use once you're familiar with it. Took me a little while to learn it, but I'm pretty comfortable with it now. And some cons, it could be difficult to navigate if you're unfamiliar with it. So like sharing it with other providers who don't know how to use My Maps could be a little hard to do. And you need to be taught how to use each map differently. So you might have different keywords. You might set yours up differently. It depends on one person to the next. And I personally feel like you have to limit sharing due to contact information and maintenance of it. There's a lot of things that can go wrong with it where it kind of loses its usability as a tool. Okay, that's a really quick version of it. Now I'm going to try my best to show you a really quick way of making your own asset map with a My Map. I think we're going to go over time, but I'll try my best. Okay, so from here, I need to share my own screen. Okay. Is that viewable? Is everyone seeing this?
Yep.
I just got booted for a sec. Okay, I'm back. Can everyone see what I've got on the screen here, the map? Okay, cool. So I'm going to do a really quick version of this to show you what the kind of the workflow is. So again, this is Google My Map. And I'm going to try and put a couple pins on here. I've taken stuff from my own map that I'm going to add on. So first and foremost, I'm going to search where we're at. Again, it's like Google Maps, so you can just search whatever you want. Ottawa, Ontario, that's where we are. Okay, so one thing that you'll notice right away is that the map itself has a lot of stuff on it that I haven't even mapped or marked. So one thing I like to do is make it a more basic base map. So that's what I choose here. There's like 9 different ones you can pick. I like this one because it shows it by neighborhood. So first one I'm going to add, I have it all saved here. You would be doing this on your own, but I'm going to do it copy and paste because it makes it faster. I'll search Carlington. That's where I work. Carlington Community Health Center. Okay, I'm going to go add to map. And then I'm going to write a little bit in there. So you can already see it has the phone number, our website, the address, and everything in here, as well as our ratings, which is very important. We're 4.5. So I've added here a little blurb about Carlington, what we offer. Again, everything that's in this pin now is now searchable. If I search anything that's within these keywords here, within the text here, any of it, it's all searchable now. So you can write whatever you want. I have things like languages that we offer. We have a food cupboard here. We have programs for services, youth. We have a crisis intake. We do income tax support. We're a primary healthcare center. We have harm reduction supplies. All this stuff is searchable. And one thing that's big with the keywords is making sure you're not duplicating the keywords. So whenever you put one in, make sure it's been recorded and it's not like a slight variation of another one. You want to have the words be used consistently if possible. So I'm going to save that here. You can customize it with like colors and little pictures and stuff like that. But for the purpose of this, I'm just going to do a handful so I can show you the searchability and what it would look like once you get a few things in there. Okay, so the next one is Centertown. Okay, Centertown Community Health Center, another community health center. There's a bunch of them in Ottawa. Okay, so again, all of this is searchable now. Okay, one more community health center. Somerset West. Okay. Another one that I really like in Ottawa is called the Psychiatric Survivors of Ottawa. They offer plenty of great services for people who've been in and out of the mental health system, who've been hospitalized for mental health or various other reasons. They have peer support. They have all sorts of great stuff. A lot of my clients like going there. I went there the other day with someone who was a little uncomfortable with it, and that was pretty cool to see their experience and how welcoming they were there. So it's Psychiatric Survivors of Ottawa. Okay. And for what it's worth, all the text that I took here, sometimes it's from the website, sometimes it's just the services that I know that I add in, but it's me managing it. And once I have it there, it's there, right? Okay. One thing that was really cool and came out of the last conference we had for social prescribing was Muay Thai or Muay Thai. It's not the drink, it's the martial art, as a way of building community and connection. It's really, people really enjoy that part. And I thought it was really cool. So I started looking around and I called a local jiu-jitsu place and I said, hey, Ottawa Jiu-Jitsu, this is what I do. Do you think you'd be able to support us with this? And they said, yeah, sure. And I think that's amazing. And they already are going to be doing it. They're going to be doing outreach with some of the youth in our neighborhood. You can see here I have, please connect with Joseph first. That's because I built the relationship with the person here. So I felt that if anyone was going to call them, they shouldn't just call them on a whim, even people within my team, because the person there knows me. So that's one reason you might be careful with how you share this. But it makes it, it's an important thing to manage. Let's put it that way. So I'll mark that. A lot of you are working with seniors. I think I actually heard someone in another presentation mentioning this place, the Good Companions Senior Center. This is an excellent place in Ottawa. And they offer tons of services for older adults. So I've had a bunch of keywords in there, but again, all the stuff here is searchable. There's information about some of the programs, about how much food costs, other things that are going on. It's a great place, and I even have people who want to volunteer there. So knowing them and having contacts there is really important. Okay. I could add a few more, but I think you're kind of getting the gist of it. You can see now that we've already marked a handful of spots on the map. Some of them are close to us, some of them aren't. I know I have, from memory now, from having done this, I know that there's recreation centers close to us. There's the actual food bank close to us because we have a food cupboard. And I can start to see where people might live. So if someone tells me their address or I search it up in an EMR, I can search that on here and go, oh, okay, this is what's close to them. It might not be their first choice, but it's close to them. And that sometimes is the most important thing to making a social prescription work. It's accessible. Somebody actually wants to go to it and take part in it because they can walk down the street. They don't have to pay for transit to get there. They don't have to stress about taking the bus for the first time when they might not be comfortable. They can walk down the street and go to it. And that might be the biggest thing for them. Even if it's not their first choice or the most exciting thing in the world. I know we're getting short on time, so I think I'm just going to jump right into, okay, questions on this.
So there was one question in the chat. Are there promotional efforts or relationship building being done to enhance awareness of social prescribing efforts in a community for grassroots programs? And is there a streamlined way for local organizations to do more of the legwork to keep their information updated or to reach out to the CHC? So that's a really good question. And there were a few other questions similar to this as well. So yes, lots of the work around developing an asset map involves partnership development. And it's crucial to understand that whoever is leading this process must have the skills to do that partnership development and that community outreach and community engagement work, because that is a huge part of the asset map. And like Joseph said, you know, including at the top, reach out to Joseph first, because he's developed a personal relationship with the contact for that service or resource. So that is a really big component of asset mapping. And, you know, also understanding that if you are adding those grassroots kind of more informal services and resources programs to your asset map, to, you know, understand whether it's okay to promote that widespread to the community or not, because some organizations don't want that general promotion. So again, that's one of those key questions to ask when you are kind of gathering that list of assets and all of the information around them. And then in terms of a streamlined way for local organizations to do the legwork, so I know 211 kind of has this model, and someone else asked as well how you can kind of include the community and other organizations in the conversations of asset mapping. So one approach that our center is looking at is facilitating some conversations with these service providers, organizations, community groups, to provide a frequent update on their programs and services. So hosting a 1-hour Zoom meeting, say once a month or quarterly, where each organization or community group has 1 to 2 minutes to provide a brief update on, you know, their current programs and services. So that's one kind of way to sustain your asset map, keep it up to date, and include the community and other organizations throughout the process as well. So I think that, I'm not sure if there's any other questions that have come up. It looks like lots of folks have shared other resources in the chat, which is great. Thank you so much for that. We'll definitely take a look at that. And yes, it is a lot of work. You do need a dedicated staff who's very aware of their community and, you know, familiar with what's out there to take on this work. So it can be daunting. I know it was for me at the beginning, but it's well worth it and really helps to provide that impactful service to your clients.
Would you take down the deck so we can see your faces and you can tell us about all the invisible, emotional, and human labor you've both done to support this presentation and to support your communities?
Yeah, it's one thing I'll say about finding services is more often than not, if you call somewhere and ask them, you have like a 50-50 chance that they're going to support you in some kind of way. You tell them you're doing this kind of work and you're trying to help people feel less isolated. A lot of services are into that, and it looks good for them in the community too.
Yeah, and I know there's a lot of organizations in our community that are working on asset mapping. So, saying that you're doing asset mapping is really important too, because why would you have 3 or 4 different organizations doing the same thing? If you can work together on it and develop one asset map, then, that's so much better than one person trying to do it for their organization. So yeah, really ensuring that you're collaborating and sharing what you're doing. And there were a few questions too around who you can share with. And it's the same platform as Google Drive. So it's the same way you'd share a Google Doc or Google Excel. You can send the link out and you can modify the privacy features based on, who has the link, or no one can view it or anyone can search it. So there is diversity in those privacy features too.
Mm-hmm. And, like we said too, I started a kind of a group within Ottawa of other social prescribers. So we meet once a month and we can talk about services we're offering that other people might want to access. I have people who live out of my catchment who live in the catchment of another social prescriber. So I can already see them on the map and then say, hey, I call them up, and then that can be the social prescription. They're already going somewhere else because it's more accessible to them. Or maybe it was Angela at the Black Focus social prescribing site at Somerset. I had some clients who had recently arrived from Burundi, and that was the best place to send them. She understood how to work with them better than I did, and it was close, and that was a huge part of it. So building that community, building those connections is really important.
And recognizing the diverse strengths, because it's strengths-based ABCD, right? And you're just like leveraging the strengths of others and having trust.
Mm-hmm.
And just, conversely for me, there's no other organizations in the area doing social prescribing. So for me, it looks like connecting to other organizations. So I know our local CAS is developing an asset map right now. So I've connected with them to kind of collaborate on that process. And, it might not be the same services and resources, but at least we can share our learnings of the process of developing an asset map. So
I want to draw people's attention to the chat because you guys did a beautiful job today. Please share respond to the evaluation so we all know what you learned and how we can do better, and how Grace and Joseph, all their energy and effort and care here.
thanks, everyone.
Thank you, everyone.